everyone, it's Dr. Shirlea North again from North Star Physical Therapy, and today we are going to spend some time talking about vaginal estrogen, moisturizers, and lubes. Oh my, I felt like the Wizard of Oz when I was thinking of the title of this podcast. But there are definitely things that need to be said, that need to be broadcasted, and this is definitely one of them. In lieu of what has occurred with whatever political affiliation you may have, this was a huge election year when it came to reproductive rights and accessibility, and this is one of them. For all of those that have a neo-vagina or assigned female at birth or identify as female, I'm talking to you, okay? Even for those that are within the trans community and have had bottom surgery, we can also speak on some things, but that will be maybe for a little bit of a later podcast because you are a specialized group of folks. And when we talk about dilators and lubricants and things like that, we will get into depth there. This is more for, again, those with a neo vagina, or excuse me, a natal vagina and born female at birth that still have a vagina and vulvar tissues. So let's get some anatomy down first here. A lot of folks don't want to say these words. It's all taboo. Guys, this is your anatomy. Or actually gals, females, people, this is anatomy. Okay, so we want to make sure we're getting the right terms. When I'm talking to my kids, I want to make sure they know the right terms for things so that way they can be better educated talking to medical professionals about what's going on with their own body. So again, this is all about vulvar tissues and vaginal tissues. Okay, so the vulva is the external part of the anatomy, the external genitalia and tissues, and the vagina is the internal canal or tube that's on the inside. When we are thinking about lubrication, not just for the penetrative act of sex, which is needed. Not everyone is blessed with a ton of lubrication. And guess what? That will change with age. That will change with hormonal changes of how much that lubrication gland is being activated and has the hormonal component to produce enough lubrication. So as a provider, I'm asking all my clientele, what lubricant are you using, not if you are. You should be using it if we want to not have tissue that gets irritated or that friction in there can irritate the tissues and therefore cause little like cuts and tears and more risk for infection. It also helps with the, again, penetrative act, whether that's through penile vaginal penetration, anal sex, utilizing toys. It doesn't matter. We want to make sure we have a well lubricated situation. And keep in mind that we also don't need a slip and slide either. Okay. A little dab will do ya. A little bit will do ya. There are several kinds of lubricants. There are water-based lubricants, and there are silicone-based lubricants, and there are oil-based lubricants. This is also a preference of the person of if they want to have something that is a little bit of a thinner lubrication, something that has a little bit more viscosity or a little bit thicker. For those that like the more like natural lubrication versus having a little bit more extra oomph in there. So there are also natural lubricants like coconut or canola oil, like things like that. But I do love brands like Slippery Stuff or Good Clean Love or Oh Yes. There are several different kind of lubricants. The one that we want to really be careful is if you have any silicone dilator or sex toy or anything like that. If it is made out of silicone, you want a different kind of lubricant. So that's my little tip of the day for that is if you have a silicone toy or dilator, whether that's, again, vagina or anal, doesn't matter. If it is made out of silicone, you want to have a different kind of lubricant. Okay, so like a water-based or oil-based lubricant with a silicone device or tool there. Okay, just because silicone doesn't like itself, and it'll start to break down the silicone, and we don't want to have that. Most of the time for my folks that utilize like a dilator or pelvic wand, those are made out of silicone, we use a water-based or oil-based lubricant. Okay, so don't be afraid of using lubrication for any kind of perineal massage, any kind of penetrative act, whether that's through anal or vagina, does not matter. We want to normalize the use of lubricants. Okay, off the soapbox for lubricants. When we are now talking about more vulvar and vaginal tissues here, that's when we get into the use of estrogen versus moisturizers. I like to think of vaginal moisturizers are like the lip balm for those lips. That's what I call it, right? So if here we are coming up to the winter time when I'm recording this podcast and taking out the chapstick for the lips on my face, we want to also make sure that the tissues there at the vulva, the labia majora, labia minora, the clitoral hood, those kind of tissues are being well moisturized, especially for those within perimenopause and postmenopause. That happens with the estrogen and progesterone changes that just occurred during that. And we want to make sure those tissues are nice and healthy there. Moisturizers can be used on a daily basis. So just like chapstick, you can use that on a daily basis. Most of the times we utilize that. It's really, in terms of like time of day, it's really up to you what your lifestyle is. Some of my clients put it on first thing in the morning, so it lasts all day for them while they're up walking around, especially if they're going to be walking a lot, like going on like a hike or something like that. So reducing the amount of chafing kind of things. And then some folks take like a shower at the end of the day and then just put some moisturizer for to kind of help soak in for like overnight, so to speak. So that can be applied again to the external genitalia, the external tissues, right along the clitoral hood, as well as the minora, right along the introitus or the opening there at the vagina. Totally normal. Okay, and this is not a taboo thing. This is not that something is wrong with you. This is those tissues need to be well protected, just like how you do lotion for your arms and legs, and again, the chapstick for the lips on your face. This needs to be normalized. Okay, and it doesn't take all but 2 seconds. Again, either while getting out of a shower, out of a bath, you can do it right then and there. So it's not a big deal. And luckily, a lot of products for vaginal tissues are made with organic products, with more natural products that have a very neutral kind of like pH number. So that way it doesn't affect your natural vaginal pH. That's where you can get into potential UTI risk or bacterial vaginosis kind of risk, is when the ingredients aren't maybe natural or organic, or they're affecting the pH, your natural pH in your vagina. So I look for things like a love brand like Medicine Mama. They have a vulva balm. They're awesome. A lot of these products get delivered in very discreet packages. So for those with like little kids and stuff, there's this huge vagina like in your face on the packaging, right? You can just have this little container that's in that one drawer where you keep all your stuff, right? Just keep it there. And that way, when you're having your final private moment in the bathroom, close the door so those kids can't get in. You can have your moment in protecting your skin, again, just like how you would lotion up any other part of your body. Vaginal moisturizers, okay? Last thing, we're going to be talking about vaginal estrogen. So this is a huge, big topic for those within the perimenopause, especially postmenopausal space, where hormonal treatments and hormonal therapies need to be normalized with your conversation with your gynecologist, your urologist, your urogynecologist, your primary care. We need to normalize looking at our hormones because your hormones affect everything. And there are symptoms of menopause, just like how there are symptoms of post-lactation. So there's genitourinary syndrome of menopause, several symptoms like hot flashes, yes, but that's not the only symptom of menopause. There is vaginal dryness, vaginal itching, urinary frequency, things like that we have these symptoms and we wonder what's going on. It's our estrogen and progesterone levels go down and there are these changes to those tissues. So utilizing something like a hormonal treatment like vaginal estrogen is huge. When I do an external and an internal pelvic exam within the pelvic floor physical therapy scope of practice, I am often educating people of how their tissues, the healthiness of their tissues or lack thereof. If I'm noticing some redness, it looks very dry, it could look white, regardless of what skin tone, it can look a little white because there isn't a lot of blood flow there. The labia minora, the inner lips, they tend to either get shrunk or they start to get reabsorbed because that tissue is looking for blood flow. It's looking for nutrition. And if it's not getting it on a regular basis on its own, it's going to sink back and be absorbed within. So if we're noticing these signs and symptoms, and they have potential urinary symptoms like pain with urination, this itchiness, this burning, things like that, and there's no UTI, we're actually in a higher risk of getting UTI because these skin changes are happening. So we're trying to utilize things within the medical community. Number one, having the conversations, and number two, getting with providers that are comfortable with doing hormonal therapies like utilizing vaginal estrogen. So I'm often talking to my clients and maybe even having a mirror so they can see what's going on. I want you to check your vulva on a monthly basis so you know your baseline, and then you can see also things changing from month to month. Or if you get a symptom, take a peek down there. So a lot of my clients within this perimenopause, postmenopausal phase, I'm educating about vaginal estrogen. I am not prescribing it. I am not a prescriber. However, I do help advocate of, hey, have that conversation with that medical provider. Again, primary care, gynecologist, urologist, a GYN, OBGYN, those kind of professionals that can prescribe medicine. Talk to them. See what your hormone levels are like. Maybe get a blood test. Maybe get a Dutch test or a dried urine test checking for hormones. Seeing what's going on, but then also if you're having these symptoms that's corresponding with this hormonal change, we may need to have some hormonal therapies involved. Vaginal estrogen is utilized maybe twice a week. So that's what's nice. It isn't a daily thing. And typically we have people put it on maybe at night. So take a shower, get undressed, whatever. But then you just put that estrogen along the inner part of your vulva. So along the labia minora and along the introitus, so the opening, and maybe a little bit within. There are some vaginal estrogens that actually go into the vagina. We insert there, but sometimes we need that estrogen more on the external part. So that again is a conversation with your provider of which one is appropriate for you, given your symptoms and given what's going on with your hormones. But we want to normalize that vaginal estrogen. There is absolutely no correlation with the amount of estrogen that's within vaginal estrogen that will affect your systemic estrogen levels. So there is a huge fear that if we give people vaginal estrogen, it's going to increase the estrogen that's floating in their blood and increase the likelihood of cancer. There's no correlation there, and that is absolutely untrue. And there's actually a huge push to change the black box warning label that's on vaginal estrogen to change the language of that, because currently that's what it is, and it is absolutely not true. There is a wonderful provider locally here, Dr. Rachel Rubin. Huge shout out. She's amazing. Her and her team are wonderful, and a huge push within the menopause space to change these things, because we need to be better providers of giving out and appropriately prescribing vaginal estrogen for those within perimenopause and postmenopause, so that these tissues remain healthy, so that we reduce the likelihood of UTIs, so that we reduce the likelihood of hospitalization and antibiotic use, so that we reduce death risk. It is huge. So vaginal estrogen, I'll get off my soapbox. Vaginal estrogen should be able to be a normal conversation with your provider, especially if we're seeing some skin changes. Again, that whiteness, the dry, really irritated tissues, the labia being absorbed. We need to be able to identify that and to be able to have that conversation to say, hey, let's talk about vaginal estrogen. Is it appropriate for me? And that way, how you use it is, again, like just twice a week. Very easy to help plump those tissues up. It helps bring blood flow to those tissues, helps to protect those tissues, helps to bring on lubrication for those tissues. There are people that do use vaginal estrogen moisturizers and lubricants, because it just depends on what's going on. So if we're protecting the tissues for like long-term use, that's a vaginal estrogen. If you're protecting the tissues on a daily use, that is a vaginal moisturizer. And if we're protecting those tissues for an activity, that's a lubricant. So I hope that helped explain a little bit of the differences. And don't worry, there'll be plenty of more podcasts. I'm going into further depth, but I just wanted to just put it out there to help normalize this conversation of vaginal estrogen, moisturizers, and lubricants, and how we need to be comfortable talking about that with our provider, as well as providers being comfortable at asking that question of what kind are they using and are they using, so that way we can help protect those tissues and have a better quality of life and reduction of pelvic health issues. All right, guys, so until next time, I hope this helped see the difference between those three. And don't worry, there'll be many more podcasts on these topics, and these are huge. I'll definitely get into each one probably individually, but just wanted to point it out there here towards the end of 2024 as we go into 2025, and as you have those appointments with your prescribers to just ask the question. All right. And so again, until next time.